By now I am sure that you've read the new health care law. No? Apparently Congress didn't read it either before it was passed. The over 2,500-page bill in large print is now an over 900-page law in fine print and in language making it very difficult to read. I know. It makes a stack of 6 inches. Let's look at what the law does. In the process, you may ask, what makes us an expert on the law when what we are saying differs from what the politicians in Washington are saying? Frankly, it is the history of the John Birch Society of more than 50 years of telling the truth. Not everyone has liked what we've had to say. The truth is not always rosy, but our track record speaks for itself. The law, called the Patient Protection and Affordable Care Act, establishes over 150 new agencies, making it the largest growth of government in our history. During the process of passage, many promises were made that all Americans would have medical coverage, it would be affordable, it would not raise taxes, and believe it or not, it would even lower the deficit. It was just too good to be true. They never explained how adding millions of people to the insurance rolls and paying for their medical bills would accomplish this. They never explained how building a huge new bureaucracy with working groups, advisory councils, wellness councils, and programs mandated for the first time in our history would not add to the tax burden. Promises. But then, when it comes to government, their track record of keeping promises is poor. Social Security is an example. We were told it would be voluntary. No longer. We were told that the maximum amount that we would be taxed would be 1%. Today it is over 15%, counting both the employee and employer taxes. We were told that the taxes we paid in would go into a trust fund, not spent as the general fund. Not since the 1960s. There is no trust fund other than a paper entry. We were told that there would never be any income tax on benefits. No longer. We could go down a litany of such programs. Aside from the promises, Social Security is broke. Medicare, broke. Fannie Mae, broke. Freddie Mac, broke. The war on poverty is a 40-year failure using billions of dollars per year. The Department of Energy, a failure, and so on. The government does not have a track record of making things work efficiently for the benefit of the American people. If past history is any indication, the increase in our taxes over the next few years will be very substantial. However, we need not worry. We are told that government has fixed health care and that it will be different this time. Everyone agrees that ObamaCare is patterned after Romneycare in Massachusetts. Romneycare has set Massachusetts on the path to bankruptcy. Liberty and free enterprise built this country. Now we are told that only government can fix things. There is no smoking gun in this law. A smoking gun tells you where the shot was fired. This law is an enabling act, a loaded gun ready to fire, and you are the target. The impetus to pass government health care legislation is not new. It has been a process in work for several decades. As part of this process, certain politicians have blamed everyone but government for the problem of rising medical costs. The insurance companies, the medical facilities, the doctors, even the patients, the aged, for example. On the other hand, the solution offered has been government programs. As we have seen, government programs do not work as promised. In the case of medical costs, it is actually the government that is the primary reason costs have gone up. Here's how it works. Prior to passing the current law, the government controlled and subsidized nearly 70% of the entire health care sector, from federally mandated and regulated HMOs to Medicare and Medicaid, from the Department of Veteran Affairs to the Indian Health Service, and dozens of government institutes such as the National Institutes of Health, the Cancer Institute, the Heart Institute, and on and on. While invisible from the view of the average citizen, government regulation and oversight already permeates the entire system of medical care, from the insurance companies to employee benefits, from medical equipment and supply companies to hospitals, clinics, and medical personnel. It is the accumulative effect of costs, not only to comply with government regulation, it is the costs at all levels where medical facilities and professionals have to employ the services of people simply to read all the regulations as they change, implement them, and then fill out the paperwork, not to mention the taxes on the medical profession. Then the government increases our taxes to hire people to read the medical reports. Are you still with me? Government at both federal and state levels regulate the insurance companies as to coverage and cost. They also stifle competition between insurance companies by limiting the number of providers that can do business in a state. Competition always drives down prices. The lack of competition drives prices up. In the case of laws such as the Medical Improvements for Patients and Providers Act of 2008, Medicare supplement insurance is standardized. One size fits all, completely eliminating competition. The new health care law does this in spades and mandates regulating insurance coverage, business, employee benefits, and medical facilities. It also will regulate state insurance commissions. In the beginning, insurance companies will be subsidized. This is why they didn't object too much to the new law. However, in the end, it will mean total government-controlled medical insurance. One of the major reasons that health care costs have gone up is the passage of laws stipulating that all who go to an emergency center must be taken care of regardless of their ability to pay. This has been taken advantage of by everyone from the indigent to the illegal alien. In fact, it has been the illegal aliens using such facilities that bankrupted hundreds of hospitals in the last decade, since hospitals could not pass on all the loss to paying patients. The problem was so acute in California, it threatened to close all the hospitals in the state. Go online and search out hospital bankruptcies. You will find 68 pages listing articles online about hospital bankruptcies. Instead of rescinding the laws, the government started to subsidize the problem by giving grants to hospitals to keep them open. And for all of us, taxes as well as costs continue to rise. And we have just given you an overview of the government's involvement that has driven healthcare costs up. This involvement has made an increasing portion of our medical professionals more and more an auxiliary of the federal government. The new law will complete the process. For businessmen, the law will be particularly onerous. In addition to fines for non-compliance, such as providing insurance for employees, the law also includes stress reduction programs for the workplace. OSHA started out as a law to ensure safety on the job. Only the authority, the structure, and the penalties were passed into law. The devil is in the details of the regulations set up by OSHA after the law went into effect. And these regulations change constantly. Anyone who owns their own business will be able to relate to that statement. It is the same with the health care law, except that the number of new agencies goes well beyond a single entity such as OSHA. We could get rid of one and still have over 150 new agencies to deal with. Incidentally, these agencies are so interwoven with cross purposes that if one is eliminated, several more will still exist to continue the program for which the first one was eliminated.